now, all day, all time, with that traffic report, just as and when you want it, with great music and lots more. Lagos Traffic Radio, your driving companion.
Your vision shapes your path. Nurture it with care. Good afternoon, dear listener. Welcome to your weekly health tonic on radio. Yes, you know, it's Eyes on the Road. Your go-to show for expert eye health insights. This show is proudly brought to you by Lagos Traffic Radio 96.1 FM. On today's show, we'll be diving into a new topic, which is ptosis. What is ptosis? From my own small research, ptosis is can be defined as a condition where one or both upper eyelids droop. It may seem like just a cosmetic issue, but ptosis can affect vision, especially in children, where it may lead to what people call lazy eye or permanent vision loss if not attended to earlier on in life. Oh yes, it also happens in adults. You will agree with me. You've seen a few adults with what we just talked about. But in adults, it could be a sign of nerve or muscle problems. It can be caused by aging, can be caused by trauma, diabetes, or congenital defects. So the question you would ask, what are the ways to prevent this? Does it have any effect? And are there treatments, if any? But we'll talk about all this. So taking us through this to further explain in details, we have our usual eye expert right here with us in the studio, talking about none other than Dr. Priscilia Imade, consultant optometrist at the Modern Eye Care Foundation, fellow of both the American Academy of Optometry and the Nigerian Optometrist Association. She's here to enlighten us on these and other eye-related issues. You're welcome, Doctor.
Thank you very much, Akan.
Looking resplendent as ever.
Thank you.
Yes, indeed. So I got that pronunciation correctly, right?
Yes. Ptosis.
Now, for those who don't know, it's P. There's a P.
Yeah.
P-T-O-S-I-S.
Quiet.
Ptosis. Just like last week, we had pterygium.
Exactly.
So I don't know. Are they related?
Yes. Well, in fact, if you notice, our topics for this month, they are all starting with P.
The etymology there, I think they're Greek origin, or
yes,
is it Greek?
Many of
yes.
them, they are
so
Greek
where you have a
origin.
P-T.
Yes. So the P is silent. The P escorted the T.
So now there my vision, my knowledge reach. So Doctor, over to you. Ptosis.
Thank you very much. Good afternoon, Lagos. I'm excited to be here. As we know, as Akam said, I'm your advocate for the eradication of avoidable blindness in Nigeria. And today I want to bring a topic. In fact, we are in the classroom. This month of May, we've always been in classroom. We talked about pterygium, we're looking at ptosis, we talked about presbyopia, so now we are looking at ptosis. Ptosis is a condition that people often overlook. They just leave it. Once they notice it, they just feel, okay, since it's not really disturbing vision, we can just let it go. But along the line, there are some consequences, and that's why I feel we should understand it better so that it can be better managed. Okay. Ptosis is just a medical term for the drooping of the upper eyelid. That means, as a human being, we know that our eyes are positioned in front. Our eyes are not positioned by the sides, neither is it at the back. It's not beneath or under. It's above. So just like our head is up, the eye is in front. And then for you to be able to see, there is a certain minimum amount of opening that your eyes is supposed to make for you to be able to see clearly and cosmetically to appear handsome, beautiful, or just okay. So when we talk about ptosis, we are referring to a situation whereby the upper eyelid, that means, what's eyelid in Yoruba or in Pidgin? Do you know? Eyelid, that's,
Eyelid
you
now,
see, you know, the eyes, the eye is a ball. Now we have, you know, you see that.
What you blink with.
What you blink with. I'm trying to see, because sometimes people don't know what eyelid is. So when you say touch your eyelid, you touch the eyelash.
Some people mix up eyebrow, eyelash.
You know, that kind of thing.
Yeah.
You see, when you blink your eye, the part of the eye that closes, what you use to close your eye, that's the one we call eyelid. We have two. There's one up and then one down. Both moves, but the one that is the upper eyelid is the one that really moves.
And it seems to be bigger.
Yes. So it covers, it's like a shutter, it covers the eye. Now, the space between your upper eyelid and your lower eyelid is what we call the palpebral fissure.
Doctor.
It's just like
down to our level.
your window. Okay. When you open your window, if you open the window, finish. Everything is open 100%. If you open it halfway, you know the amount of light too that will come in. Yes, something like that. That's the best way I can explain that. So the upper eyelid helps, you know, to open and close the eye. Now, for you to be able to use your eyes efficiently, effectively, and for you to be able to see very well, your upper eyelid must, when you open, it must open and then stay on top of the cornea.
Okay.
There is a relationship. Yes. There is a certain limit it should stay on without you making any effort. As in, when you open your eye, you are not supposed to make an effort to keep your eyes open on its own. So, but for some people, you just discover that upper eyelid, instead of staying retracted so that like 1/3 of your eyes are actually open, you discover that the eyelid will droop further down into the black of the eye. Let me use that word.
So it looks now like you're sleeping.
As if you are sleeping. Exactly. So when you look at people, you look at their two eyes, it looks as if they are sleeping. It means they have ptosis when they are not actually sleeping. You can find ptosis in children as well, very common in children. You just realize that the eye does not open. And then it can affect one or both eyes. And when it happens, especially in childhood, attention should be paid to it so that it does not grow with that child into adulthood. It can also occur in adulthood, but we are going to talk about the causes shortly. So for the causes, right away, it can be congenital. When it's congenital, it means the child is born like that. Now, I've seen cases of children that were born, especially assisted delivery.
What we call
in the
CS.
process of, it could be, and then sometimes, those days they used to use forceps.
Okay.
So, there are different forms of assisted delivery, and then people who deliver at home too, in the process of trying to pull the child out, sometimes they can damage the nerve that controls, the upper eyelid. So you find out that some children, as they are now growing up, the innervation to that eyelid becomes affected. Their eyes does not open. Some are just born like that. That's the way, right, maybe from developmental stages in the fetus, as a fetus, they had that issue.
But could it have been caused by maybe something?
There are quite a number. Drugs, medications that the mother took, alcohol, smoking, anything that will affect the health of the child. You don't know where, the structure in the fetus that will be affected. Medications too, especially steroids. These are things that the health of the mother as well too can affect.
Can tell on the fetus.
Yes, the child. So when that happens, ptosis can develop, and when it develops, it will now make the child to look a bit awkward, and some people really feel shy about it.
But Doctor, aside the cosmetic part of it,
yes,
where the person feels a bit less,
can affect vision with time.
I know I've seen one or two people who somehow have grown up with it and have looked, have been able to find a way to compensate. You see them, living life normally, but medically, is there any
there are side effects? Yes, of course there are. I'm going to talk about that much later.
Okay.
But if it occurs in childhood, we have discovered that many parents, they just overlook. They just ignore. Just say, na so I be, since I born na so it be. It's not supposed to be like that, please. If you notice that on your child, please, you need to take that child for an eye examination so that the needful can be done as the child is growing. Corrections can actually be made before it is too late. Also, ptosis can be acquired. The child may not be born like that.
How do you mean acquired?
When you mean acquired, it means something can happen. For instance, certain medications children are given can go and damage the nerve in the eye. Sometimes too, some children may, due to trauma, some parents, their babies will fall down, hit the head on the floor or something, and then they are not aware. Before you know it, the nerve that controls the eye is damaged, and so the eyelid cannot open. So trauma can actually cause it. It can be acquired. Sickness, some children may be affected by certain under 5 diseases.
Okay.
And when that happens, before you know it, it can affect the eye, and once that nerve is damaged, it's a big problem. Aging can also cause ptosis. This one too.
Adults.
For adults. For people who are above 40, 50, 60. Because as one is aging, the nerves in the eye can now be getting weak. So he's no longer able to move the upper eyelid as he should. Or sometimes excessive fat under the eyelid makes it difficult for you.
Fat?
Yes, fat. Accumulated fat under the eyelid can actually make it difficult for you to open your eyes. Sometimes too, you could have neurological disorders, trauma, neurological like cranial nerve palsy. Sometimes tumor in the head that is compressing the nerve that controls. Yes, it can happen. Muscular diseases, and quite a number of factors. Sometimes too, post-surgical issues. Some people may have eye surgery, and at the end of the day, some nerves may be unfortunately, they may be damaged, and ptosis can occur. So there are quite a number of reasons. But statistically, anyways, ptosis will affect about 4.7% of adults over 40 years globally, and then congenital ptosis occur in approximately over 800 births, and is more common in older adults due to age-related tissue changes. And between male and female, the statistics is like 50-50. And how do you know that somebody have ptosis? The eyelid will be drooping.
Okay,
that means,
so Doctor, how do you know someone has ptosis? Can we just take a traffic update from that end? Okay, so slow and steady vehicular movement. This is around the Sabo roundabout, moving towards Sabo Nimalu. That's inner parts of Ikorodu. Onwards, Alaka, low-cost housing estate, Jendol, Nasfat, Sawmill down to Itamaga, towards Lucky Fiber, Maya, Adama, all the way down is looking good. Itamaga connecting Iduroko, Select, Baga, Umitoro, Eleshin, down Elekpe is a very good one. Looking at the Maryland Ikeja GRA traffic update, it's good on both sides. Service lane along Maryland Anthony intersection on route Odoyalaro, and for those veering towards the Mobolaji back Anthony Way, inwards and outwards at this time, still quite fair. Obakran Link Bridge, local airport Link Bridge, all good. Obakran Road, Kodeso Road, local airport road, Obakinjobi Way, Ikeja GRA, likewise in and out of Mobolaji back Anthony Way, still looking quite fair. Afternoon traffic update from the Egbeda Yanopaja axis. For those coming from Barua, Abeson Gate, all the way through Mashalashi inwards Yanopaja roundabout, it's still looking quite fine. Of course, return journey influx is a thing to be expected much later on as the day progresses. Mashalashi connecting Isheri roundabout through Egbeda intersection also a good one. Return journey good. A bit of a delay at Egbeda due to alternation on that corridor. And then onwards, Goyi Pleasure on the Lagos Abeokuta Expressway is encouraging. A bit of a delay on the Yanokwaja Bridge. The return journey also quite fine. No impediment this time cited, and we have traffic managers well placed doing the needful around this axis. We are discussing ptosis, which Dr. Priscilia has gone to lengths to explain about, told us what it looks like, what causes it in children, in adults. We would love to hear from you. I already have a question on WhatsApp. Okay, this person wants to know, doctor, that you mentioned fat. Does this mean that fat people are at risk? Fat, you said fat could be one of the causes. I think that's what this person is trying to say. So do let us know. Let's just quickly, the numbers 0891-538-77127. Feel free to call in. And you can also send a WhatsApp message 080-991-20777. Doctor, fats.
Yes,
fat,
thank you.
people.
Obesity could be a risk factor, but when I mention fat,
Yes.
I'm not necessarily referring to fat people.
So it doesn't
You see,
mean...
some people, no.
Okay.
Some people accumulate fat in different places.
Okay.
Now, for the eye,
Of all places
sometimes
to
you just
accumulate
find that, yes, you fatty tissue deposits underneath the eyelid. Sometimes you find out that some people around the eyes, towards the eyebrow,
Okay.
we just see certain fats coming up. Sometimes people have what is even called lipoma. That's fat deposits around.
Some people will
you
say,
know, the eye.
you don't
So
fat.
fats, no. Actually, when we talk about fats predisposing one to it, it's not necessarily fat as in body fat, but unnecessary fat that is accumulating around your upper eyelid or around the eye region can actually make it,
We have a call.
affect your nerves.
Elder.
Make it impossible for you to open your eyes very well.
Yeah.
My doctor, how are you?
Good afternoon, Dr. Wagbadi.
How are you?
I'm fine.
The Yoruba name you are looking for. Penpeju. Penpeju. That's what Yoruba.
Eyelid. Eyelids.
Eyelid. Say it again.
Penpeju.
Penpeju. Okay.
Doctor, you're writing it.
Yes, sir. Penpeju.
Thank you very much.
Thank you very much, Elder.
Right,
Yes,
right as pronounced.
Yes.
Thank you very much for that.
That's great. Thank you. I really appreciate it from Elder Tewobade. Yes, we must be able to, communicate some of these things in our local
indigenous languages.
Yes.
Doctor, we have questions on WhatsApp. This person says, any way out of this, especially if it happened from when the child was just a fetus? Are the treatments same for natural and for locum? AK from Egbeda.
Thank you very much, AK from Egbeda. In fact, it's the causal factor that will determine the approach for treatment. So once the diagnosis have been made, then we'll try to remove the causal factor first
of all,
and then whatever it is, if it can be corrected surgically or by exercise or other means, then that will be advised. But we always encourage that if it is found in childhood, please don't allow it grow with that child into adulthood. It can actually be treated.
Okay.
But what I find out in my years of practice that people just overlook it. Like I said in my intro, it is one eye problem commonly that parents just overlook. They just say, now so the eye be. In fact, there was one patient I saw that told me, say, in our family we are like that. He said the father is like that. The father's uncle is like that. Just leave her. That kind of a thing. Yes, ptosis can be inherited. It can flow in families. You just see their eye. It's not opening. Just say,
So it's hereditary too?
Yes, it can be inherited.
Wow.
Yes.
Okay.
So, but when it happens, the symptoms is that number one, you just open droopy eyelids. When we say droopy eyelids, it means the upper eyelid that you have is not opening on its own properly. I once had a patient who had ptosis on one eye. Anytime she wants to see, she will not use her hand to raise
my God
the eye up. So she came for an eye examination. We do one eye at a time. And I said, okay, let me take your view. He said, doctor, I can see with the eye. It's just that it's not opening. She used her hand to raise the upper eyelid. I was reading. I just laughed. She said, well, that it happened in childhood. Nobody cared about it. And now she just have to learn to accept it. But although it gave her a negative school experience, while she was in school, people used to laugh at her. I think there's also a name they call it, locally and things like that. But I think it's something parents we need to pay attention to, especially in childhood. And also, there are certain occupations that if you have ptosis, you can't actually participate in. Yeah, you cannot. You will not be taken because of the cosmetic appearance and the fact that it may likely affect your field of vision. Your visual acuity may be good. You may be able to see well with the eye, but the fact that it can affect your what we call your visual field, your field of vision, because there are certain tests you want to do that would require you being able to see 360. When we are mapping the eye, we map it as a circle, 360 degrees. That's what it should be. And out of that, you are expected to see like 120. But when somebody have ptosis, when there is ptosis, the person may not be able to see very well. Imagine a pilot with ptosis. What's going to happen? You go to Bermuda Triangle.
Okay,
we use autopilots and just drive. So it's going to reduce your field of vision, eye strain and fatigue. Actually, you see people that have ptosis when they want to read.
Yes.
Either they are looking down completely to read, or they will now try to raise their head up. So that can bring strain. And then if it's computer, the computer is somewhere at maybe 60 centimeter. You find out that it's even more strenuous because they have to position their head in a certain angle to be able to see very well, especially when it's bilateral ptosis, that's in the two eyes. So it's really straining, can give fatigue and then tilting of the head backwards, and then it results in asymmetry. That's the two eyes not looking the same. Let's quickly look at the major risk factors: advancing age, history of eye trauma, surgery, neuromuscular diseases, and then for some people that use contact lenses too, rigid contact lenses, although that's gradually being phased out. And of course, family history of ptosis. What are the complications? Amblyopia. We have talked about amblyopia on this program, especially in children. When a child has ptosis, the upper eyelid is not opening very well. You just leave it. It can start reducing the vision in that eye, and before you know it, the brain will start ignoring messages from that eye and just focus on the one that is open. So over time, amblyopia can occur. The eye becomes lazy. Headache and neck strain, vision impairment, cosmetic concerns, and asthenopia, that's eye strain, can actually occur. And one of the ways we diagnose them is when you come in for a medical examination, we can check your visual acuity and your field of vision. And of course, we measure the eyelids. You see, when it comes to this eye thing, we take measurement the same way tailor. We take tape and measure your shoulder, measure your waist, measure. Well, in my clinic, if we want to do glasses for you, now say we go measure you. Doctor, we have a
message on WhatsApp. Please, doctor, does having ptosis stop me from seeing properly?
Yes.
I'm a driver of many years, and I see with the eye. I have this condition without any inconvenience. Do I have to still worry about this Dega from Oshodi?
Dega from Oshodi, you are the one that passed yourself. The Lord did not pass you. The eye doctor did not pass you.
Doctor, I know someone around us here who
you are using one eye.
And the guy is functioning normally, doctor. Yes.
See, most times.
It's just that sometimes I feel he's like he's looking at like he has this.
See, I can. You know. There are visual requirements for different occupations.
Yes.
So, and sometimes here in Nigeria, these visual requirements, they are not strictly adhered to. And one thing I've noticed about Nigerians is that we sabi be pain. We are very resilient. We know we can navigate and manage situations. So far as there is no law that is, on our neck to say, oh, it must be this or it must be that. Yes. So for this guy that called, that sent that message now, if we take him into the eye clinic and test, he will not pass. If he's in a developed country, they will restrict his driving. We are not saying you should not drive, but your driving will be restricted. For somebody that have ptosis, the life of maybe 18 people, 12 people, 10 people cannot be committed into your hands daily. Highest, they will commit your family, your wife and your children, be driving them, and then restrict your roots and things like that. So it's a very serious issue in developed countries. It's just that here people don't really care, and when somebody has one eye and is seen with that one eye, just feel that he or she is okay. So, but I think we should begin to pay attention to it, because actually people that have ptosis can actually result in road traffic accident. Because what happened if you have ptosis on the right eye and you are doing right-hand drive and something is just coming by the right, but before you can turn head,
how do we handle this?
Okay, well, the management depends on the cause and severity. Surgery to treat the levator resection, levator muscle, the muscle that pulls the eye up. If it's damaged, it can be reattached or resection. Otherwise, there are some other cosmetic treatment that can be given. And if there is nothing anybody can do, your occupation can be restricted, and the kind of use to which you put your eyes can be restricted. Management is regular monitoring for progressive changes, addressing underlying systemic conditions. People that have diabetes, diabetes can affect your eyes, or your eye will not just open, especially if your sugar is high today, low tomorrow. If it's fluctuating,
so diabetes
unmanaged diabetes, complications from diabetes can actually result in that. And also there's vision therapy as well that can be helped that can help children. Supportive care and counseling too. Also prevention. There's actually no specific prevention for congenital ptosis. That's the one that happened from birth, but you need to prevent trauma to the eye and early treatment of underlying neuromuscular disease. You need to avoid prolonged use of rigid contact lenses. For people who use contact lenses, please, you have heard now. And there are occupations that are mostly affected. People that have ptosis, some occupations that we just not just want them to that will give them a hell of a time. IT professionals, drivers, should be that driver you have heard though. Clear and wide vision, like surgeons, machine operators, pilots, professions with a strong aesthetic and public interaction component may be more psychologically affected.
We can go on and on, but the truth is time is not our friend. I even have more questions. Somebody was asking that, saying, well, that is it the person's name is Tosin. So as you were saying Tosis, the person was jokingly saying, is it because somebody whose name is Tosin? I was like, no. Let's not ask you that. That will distract you. Dear listener, we've come to the end of the show. We bring you this show every Thursday to avoid stories that touch as regards your eyes. So getting blind is real. Please go for regular checkups, and if you have any complaints or difficulties you might be experiencing, just go and check your eyes out. Do not forget Dr. Priscilla's book. Grab a copy. Glaucoma, the Silent Thief of Sight. Dr. Priscilia Imade, body knock author, a serial author at this time, 3 books to her credit and more to come. Remember, your vision is crucial. Stay safe, stay sight healthy. If you missed any part of today's show, remember you can always go to our YouTube channel and Facebook page. Our Facebook page is Lagos Traffic Radio 96.1 FM. Our YouTube channel is Traffic Radio 961. Search for the keywords Eyes on the Road. Thank you very much, Dr. Priscilia Imade, OD, MSc, PhD in Public Health, consultant optometrist at Modern Eye Care Foundation, and a fellow of both the American Academy of Optometry and the Nigerian Optometrists Association. Yes, when I grow up, I want to be like you. For inquiries, please, you can reach out on 080-3333-6672. That is 080-3333-6672. You can reach them at the clinic, plot 16 to 18, Ogunosi Road, opposite Omole Estate, Phase 1 by Akiode Bus Stop, Ojudi Baja. On behalf of our production team, ably led by Micah and Rocha, with assistance from Bakri Kausara, and not forgetting Ojo Milan and Meroy Oluwa Nifemi. Executive producer, of course, Tayo Okonli. My name is Akan Usen. Eyes on the road, your safety, our priority. Lagos Traffic Radio. See you next week.